Good evening, everybody. How are you? Okay, let's just take the small period and then take care of ourselves and do some things that will actually help us. All right. So we'll be talking on delay menstruation and its complications to our health, to our fertility. So we'll be able to address the issue of delayed menstruation without taking it as normal thing. So right now, let's talk about delayed menstruation. What do you understand about delayed menstruation? Where your menstruation is actually supposed to come out on the 28th, depending on your cycle. If your cycle is 28, 32, if your cycle is 20, if your cycle is 20 something, whatever it is. Once there is delay in the consistency, there's alarming issue that conception will be an issue for you. So it's going to affect your fertility. So if you're having issues with conception, if you're having issues with conception, you have to look at the delay aspect of your menstrual cycle. Your menstrual flow, your period flow, at every given time, the consistency matters a lot once we're talking about fertility. So right now, when we're having complications with fertility, we can actually address the issue of this delay menstruation and then get it right. When we're having fertility complications, one thing is actually in our mind. What this delay menstruation causes in our system is irregular ovulation. Delaying menstrual cycle flow can actually cause disruptions in our ovulation, making it so difficult for conception. Another thing we can actually do again when we're actually looking at the delay conception and its impact, delay menstruation and its impact in our system, is nothing else than the reduce in the fertility window. Once there is delay in the menstrual flow, there is delay in it shortens the fertility window, making it so difficult for a woman to be pregnant at all. All right, we'll talk about the increased risk of infertility. Prolonged delay in this menstrual cycle can actually bring a lot of cases, a lot of issues, and then increase infertility in our body, infertility in anything at all, in our marriage and the rest of it. How? Because it brings forth imbalances, hormonal imbalances into our system, and then ovulation disorders will actually set in. There are health complications that actually involve in this issue of hormonal imbalance. When there is hormonal imbalance that has already set in as a result of this high risk of infertility result associated to hormonal imbalance, the complications are large. Among those complications, there are so much imbalances in the system associated to deficiency in our conception, deficiency in the vitamins in the system, including our mood swing that is associated with the fluctuations, a lot of things, the breast tenderness, a lot of issues that are actually assigned to this very hormonal imbalances. Once there is complications with this hormonal imbalances, you actually see the physical sign. With the mood swing is there, the breast tenderness is there, other things are equally there. You can actually see yourself adding so much weight, just like somebody that has low estrogen. You can actually see the person increasing in the size, the weight size, your body mass and the rest of it keep increasing because it's associated to the physical signs of these complications we'll call hormonal imbalance. We'll look at the nutrient deficiency aspect of this health complications of delay menstruation. When we're having delay menstruation, we'll have a lot of issues leading to nutrient deficiency, particularly not deficiency of anemia, particularly the deficiency associated to anemia and due to reduced menstrual blood loss. Do you understand? Once there is this delay, once there is deficiency in the nutrient sufficiency or the nutrient the person is having, there will be complications once there is once you want to menstruate. So looking at the nutrient aspect of it, the nutrient deficiency, you have to help yourself so that you'll be able to navigate those challenges associated to the delay menstruation. We'll talk about the high risk of osteoporosis. Delay menstrual flow can actually increase the risk of osteoporosis due to the reduced estrogen level, which is essential for maintaining bone density. So you have to be very, very careful because it's a risk factor to osteoporosis once you're having delay menses. So you have to tackle it, you have to look at it, you have to call on your health providers, you have to go to hospital, you have to take care of your system. Then we'll look at the increased risk of cardiovascular disease. Delaying menstrual cycle flow can actually increase our risk to cardiovascular disease due to hormonal imbalances and changes in the lipid profiles. These are associated together. Your lipid profile, which we're talking about, your triglyceride level, your cholesterol, we're talking about the total cholesterol, we're talking about the high density lipoprotein, the low density lipoprotein. Do you understand? Very low density lipoprotein as well. We're talking about the 5 total parameters of cholesterol that you can actually find in the lipid profile. So you have to be very, very careful. Check it out and know what your lipid profile is saying today. Then we'll talk about the increased risk to endometriosis. So now that can actually lead to cancer as well. Delayed menstrual cycle can actually lead to endometriosis, so you have to be very, very careful and do a lot to gather the strength, the vibes, the energy to believe in yourself and move straight to meet your health providers so that you'll be able to address the issue of conception, the issue of infertility in your sperms, so that you'll be fine again. All right, we'll continue. Okay, we are still talking about the same issue of increased risk to endometrial cancer. So increased risk to endometrial cancer can be as a result of delayed menstrual cycle, which is the risk of having prolonged exposure to estrogen. So we have to be very, very careful when we are talking about this. So we'll talk about the causes of delayed menstrual cycle. What are the causes of delayed menstrual cycle? There are several things you have to understand because we have some causes of this delay. There are several causes of delayed menstrual cycle, which hormonal imbalance is not actually deleted from it. You know, when we talk about hormonal imbalance, the ones associated to which is polycystic ovarian syndrome, it can actually be associated to thyroid disorders, it can actually be associated to a lot of it. Other hormonal imbalances can be as a delay of menstrual flow. So you have to be very, very, very careful and take this information serious and then subscribe to our YouTube channel so that you'll be able to address the issues of your fertility at home. And at the same time, we'll talk about the stress associated to this delay of your menstrual cycle. Your stress level every month can actually delay your menstrual cycle. The physical or emotional stress can actually disrupt your menstrual cycle and then cause delay flow to your menstrual cycle, menstrual flow. So you have to be careful. The weight changes. When you significantly add in weight or lose, it can actually cause some level of delay in your menstrual cycle. So you have to be very, very careful when we're talking about this. The challenges you're having every day, your thought, your mood, and every given time, the kind of foods you eat, the things you take, the drugs you take, the medications you take can actually lead to a lot of delays in your menstrual cycle. So you have to be very, very careful at the same time. Okay, so you have to be very, very careful and then take care of yourself. You have to work on yourself. Avoid taking medications without prescriptions. Avoid doing a lot of things. And in it, you should also know that there's other underlying medical conditions that can actually lead to the same delay and cause a lot of things to you. We talk about the pituitary tumors. When we talk about pituitary tumors or we talk about the premature ovarian failures, it can actually lead to this. There are a lot of issues that can medical underlying issues that can actually lead to menstrual delay flow. So now we'll talk about the treatment measure. There are other treatment options you can actually do. There are hormonal therapy that we are being given. There is hormonal therapy that is being issued to patients. There are a lot of things that can actually be done in order to do your exercise measures can actually help you. Those replacement pills can actually help you. Those control pills can actually help you, like clomiphene can actually help you as well. Fertility medications like clomid can actually help and address the issues surrounding the delayed menstruation, your exercise level, your mood at every particular time, the reduction in the stress level, and the rest of it can naturally equally help you. Trying to make your hormone so balanced on your own, trying to make sure you're happy at every given time, try to exercise on your own, try to eat fruits and stay hydrated, it can actually help correct underlying issues that are surrounding to this delayed menstruation, and in so doing, it